I'm going to talk about our process in the nursing program in fourth semester. And in fourth semester, we are the last semester of the program. So it's important that part of what we're looking at is how are students putting all the information together that they've learned through all the other semesters. So one of our course learning outcomes was that students would be able to apply the nursing process in all aspects of patient care. In prior semesters, they've learned how to do it in this little aspect or for this disease, and now we want to look at the whole picture. So we developed a rubric to look at students' performance in the clinical setting, and applied this rubric in the fall of 2011. We applied this to a subset of 16 students, which was 2 students from each clinical group that we just randomly selected and said, okay, we'll look at these 16 students. What we found with that is that we needed some kind of guide so that all of the faculty, including our 6 adjuncts, or there are 8 of us in clinical practice, were using that rubric in a similar kind of way with similar standards, that we needed a guide. We also needed a packet of all the expectations for these CLOs because people got very confused, and it's like, what paper? And at the end of the semester, I didn't do that. So we decided we needed a guide and that we wanted to really evaluate all the students, that we didn't want to do a subset. So for this particular SLO, or CLO now, we made those changes for the spring semester. We tweaked a little bit the rubric so that we expanded the scoring numbers, and then we developed a rubric guide that said this is what we're looking for in this particular rubric subset. And so that, and then we had conversations about those components of the rubric in our team meetings, which we have on a weekly basis with our adjunct faculty and our full-time faculty, so that we were trying to apply this more consistently across the board with all of our students. And then we also decided that we wanted to specify we're going to do the first rubric on a certain clinical day, and we're going to do the follow-up rubric on another specified day, so that we have the same amount of time between our initial assessment and our follow-up assessment of the student's capacity or ability to do this in the semester. So that was all implemented in the spring semester, which we discovered worked much better, and we got more consistent scores. Where there are still issues that when we evaluated that particular CLO, we came up with new things that we still needed to clarify even a little better some of the items on the rubric, and that we were going to continue using this not just every 4 years, but we are going to use this rubric and this particular scoring process so that we look at students' clinical progression over the course of the semester in every semester. So it's something that has enhanced our practice and made us feel like we've got a better handle on how we're really concretely assessing skills in a clinical setting that can be a little bit obtuse if you don't get yourself focused on them. So we're excited about it, and we've changed our practice as teachers because of it.